muscles are tight up in here. So who knows, he works, he plays, he does whatever he's doing. I'm gonna take your chain off, okay?
Okay. Put it in my hand.
There you go. Yeah, I don't need it. Enough chains. So, come over here if you can record this. See right over here, there's some congestion up in here where this is a little tight. So I'm gonna start with this thing. This is Gua Sha, or scraping.
Okay.
What I'm gonna do is right on this area, I'm just gonna start to scrape like this. So it may need a little lotion or oil. I usually don't use that because I usually just use some water. So I'll take a little bit of water and I'll just get that wet. And now I'll scrape this right up here into his neck. And what will happen is you'll see it getting red. See the redness up in there? So what I'm doing is I'm actually breaking little blood vessels. Okay, so he gets red pretty quick. So we brought a lot of blood up there quickly. I'll do the other side. And you got to watch out. Here's the spine right here. So you don't want to go over the bone. Now, this can be done with this thing, you know, a scraper like this. Sometimes what I'll use is piece of plastic. Does that hurt? Sometimes I'll use a spoon if I have one. I don't have a spoon here. And sometimes I'll use, this one's made out of bamboo. So the bamboo one, the same thing. I just do a scraping like that. So I seem to get on George the best effect with this one. And you can do it like I'm following the muscle here. So the muscle goes like this. Here's the bone. You don't want to hit the bones because the bone hurts. So I'm just watching out for the spine and going all in this area. See, the redness just about went away on the other side, but we brought the blood up there. And now I'm going to switch to cups. Now cups sometimes are used with fire. So I don't have a fire cup here, but a fire cup, usually they take a few things when we do fire cups. This one happens to be plastic, but I'm not going to use this. I'm not going to use the plastic. So if you take a cup or like one of these glass things I have over here. So I take a cup and get some alcohol. And I just put a little alcohol on a piece of cotton. And just wet it a little with it. Does anybody have a match? I do. Okay, so what you're going to do is you want to take the air out of the cup. So you light this, and how I usually do it if I'm doing a lot of them, what I'll do is I use a match. I'll use a candle. So what I do is here's the cup, I go like that, and see how it starts to suction? And what it'll do is it'll suck the air out. But in this office, I don't usually use that. I use, instead of a glass cup, I use these cups that are really handy. These cups work with the suction. They're glass and they come with a pump and they work just great. Okay, so here's a cup. And here's the suction thing. So you put it on, and like I said, there's a little bit of congestion up in there. So I just put it on there and draw the air right out. By drawing the air out,
Interesting.
and it stays on there pretty good. And what it'll do is it'll just relieve any type of congestion in there. So if he's got a blockage, some type of pain. Might look like an octopus kissed him for a while.
Hurts.
Okay, well, I'm going to put one more on.
Hurts a lot.
Oh, actually, you know what?
See, and we start to get some redness in
Yeah.
there.
I was looking at the color.
So I'm looking at the color, like this one's red, this one's pretty red. It means there's some type of congestion in there. So I'm just going to take these off. They're real quick. And look at, there's some moisture around this one.
Is that bruising or because it's turning to purple or what is that?
Well, purple means there's a blood stagnation. Something in there like this one, one over here.
Right.
That means there's some type of stagnation. Then what I'll do is I'll just roll them out. And like this one will be gone by this evening. These other ones with the red in it and slightly purple, they're going to last for a couple of days. And this just moves the blood around in there. And this way I get all this, see that little redness around there? That's from the Gua Sha, and this is from the cupping. And what this will do, by bringing more blood in there, it brings in more oxygen, more blood, and this will relax. And if you can see, 1, 2, 3, 4, plus over here, you can see there was some stagnant energy in there. So we're just going to open all that up and let that energy flow through. I'm going to show you another one. They're called sliding cups, and this is also a great technique. George, if you would just lie on your stomach for a second. This one I'm going to use a little oil. Whoops. So I just put a little oil on here. This is a Chinese oil called Po Saman. And with this stick, I just do a little Gua Sha up and down the spine. See if we get any redness here. Okay, not bad. This will get the blood moving, it'll get the chi moving. Then I'll take the cups. And the reason they call this sliding cups is I put one on here, and I'll put one over here. And now I'll use the cup as a massage tool. So see the suction in there? You can see the skin coming up. So as the skin's coming up, see that one fell off, but we'll just put it back on again. And this way, I can go up and down both sides of the spine.
That's interesting.
And if there's any congestion in there, any blockages, how's that? Is that okay?
Yeah, it's fine.
Look at how red that is now.
Yeah, right. See that? See the redness coming up right there?
Yeah.
Whoa. Yeah, he's got a little bit of congestion in there. Just break that up. See, in different points, like the ones down here, this is really good for the kidneys.
You can do that one a little harder.
Okay, so I add a little more. Get a nice suction on there. And then, see that side's getting pretty red. Whoa. And this one. Now, when I did medical Qigong, whoa, that's a nice one, huh?
Mm-hmm.
See that? We're getting a nice color in there.
Is he getting that red like that because he's well hydrated also?
Well, he's getting that red in there because we're breaking blood vessels, actually. But by breaking that blood vessel, it'll take a few days for for that redness to go away. But what it'll do is his back is going to feel much looser.
How's it feel, George? George,
Good.
Yeah, it's like a massage.
why don't you describe how it feels?
massage.
In this way. Now, doing medical qigong, what they do is they put the cups on. And then what you'll do is you just grab energy, pulling that energy down and sort of twist it into the cup. So energetically you're putting in more of your energy or more of your chi right into that. And then you can really move it around, open this up. Right. And then when I'm through, because the treatment doesn't take very long, I just take a piece of paper or cloth, and wipe that right off. It's a nice treatment, it's easy to do, there's no bad side effects, and the patient feels great. I'm here today with a patient who has tight shoulders and a tight neck. When that happens, there's some things that you can do to loosen them up. Now, if you feel in here, oh, these are like rocks. She's got some rocks in here, probably from tension, stress sometimes, and all these muscles just tighten up. Interesting enough, the muscle starts here, goes all the way up and over the head, so sometimes you'll even get headaches. So what I'm going to do is I'm going to free these muscles up, and I'm going to use a technique from postural integration, deep tissue work. So here's how it goes. I'm just going to get up here. I'm going to take my elbow, and I usually don't use oil because you slip. So what I will use is I have a glass of water right here, and I'm just going to take a little bit of water and just put a little bit of water so we can slide. Okay, just regular water. Now, I'm going to just place my elbow right here, and I'm going to slide along this muscle. If you do it, there's some bones here, and she's little, so you don't want to hurt the bones. You don't want to hit the bones. You want to stay on the muscle. Okay, so I'm going to apply it. How's that? Is that too much? Is that too much?
Good.
That's good. Okay, and I'm just going to start to slide. How's that? Okay? Right, yeah, you'll feel some of it because I can start to iron out the tension just by slowly moving. And I'm using my whole forearm to release this. You okay?
Mm-hmm.
Okay, breathe in a little. And then I'm just going to knead it. Ooh. And all this will release this muscle in here. And she's a little tight on this side coming down here too. So I'm going to do another stroke on that, but let's do the other side first. So again, I'm going to get a little bit of water. And the reason I use water is water just gives me a little moisture. And I can slide. Anastasia, come over here. Come around so you can do this. See this. Okay, so I'm just going to put a little moisture on here with the water. And now that I've got the water, I'm going to take this side of my forearm. I think I use this one. I use my left arm. I'll take this side of my forearm. And I usually put my body there so she doesn't fall over. Now I've got her. And then I'm just going to gently slide along there and start to release that muscle. And again, release the muscle. And again, I'll go back to the kneading and release some of this. This is great because this really loosens up the thing. Now, if you wouldn't mind sitting here on the end, I'm going to do one more stroke. Well, we're going to actually do a series. What I'm going to do is I'm going to do a stroke all the way down the back, and then I'm going to do a stroke on her neck and release the neck. So we'll release the whole back, the neck. She's going to feel great. Here we go. Okay. This one, again, whoops, got the water. I'm going to put a little water, just like this, on both sides of the spine. So if you do this on somebody, here's the spine in the middle. All right? So I don't want to be on the bone. I want to be on both sides of the spine. Okay. So if you get behind the person and you take your elbows, and you're going to imagine you have a beach ball on your belly, right? Right here. And then you're going to come toward me a little bit. And then as I go down, you're just going to roll over the beach ball, okay?
Okay.
All right. So I'm going to start up here. Okay, take a deep breath in. Let it go. Now drop your chin to your chest and start to roll forward. And as she rolls forward, go slow. I'm just going to keep a steady pressure on both sides. And we're going to go all the way down. All right, you slowly come up. This releases all the muscles in here. This will loosen up the whole thing and it'll help with the shoulders. Nice, how you feeling, okay?
Yep.
Great, we got a couple more strokes. So if you lay on your back, I'm going to show you the neck strokes. We'll release the neck, put your head up here. Great. These muscles in here get all tight. See all this? When we get tension, it happens in the shoulders, it happens in the neck. So I usually start by holding their hand and embracing, and then I'll do this. Okay, you release. You release. Just give me the hand. Come on, give it up. It's hard to get a girl to give it up. You give this up. Come on. No, I want it. I want it. You release. You release. Let me have this hand. Come on, let me hit. Oh, yeah. Oh, no, give me the hand. So we're going to try and get this. So she's holding on to that pretty tight. We'll try the other side. Okay, again, I'm just going to take my fingers and put my fingers with. This side's a little. No, release.
Oh, release.
There, you put your attention right here. Okay. Okay. And we're trying to release. She doesn't release too much too quickly, so we might have to do this a few times. Okay, now let's come over here to the neck. I usually start out and just embrace the head and do a very slight traction. Okay, by doing that, get a little more length in here. And again, and I'll take some water and I'll just put a little water on the side of her neck on both sides. I'm going to have her a little juicy. Ooh, she's going to be like Lucy. And then see how she's little. She's little. See how my fist is big? So I can't use my whole fist on her. I'll just be able to use a few fingers. So I'm just going to place it right here. And I put this hand over here so she can't get away. So she's relaxed. And you're going to start turning your head away from me, okay? And I'm just going to, right, you got to breathe at the same time. Breathing's real important. Because I had a patient once didn't breathe for days. And she's still laying on the table in the other room. Okay, now the other one, I'm going to just move your head to the side. Can you get this over here? I think maybe if you shoot from that angle. So you want this. So see this muscle in here? This goes all the way up in there. Sometimes you'll get headaches in here and stiffness. I'm